Okay, so today we'll discuss on the serum total protein estimation, how you can estimate. So these are the different methods like biorate methods, which is very common and you have also used in the laboratory. KZ methods, Lowry methods, ELISA and the RIA. And ELISA and RIA is more specific, but commonly it is not used. Most commonly used is the biorate methods in the for the practical purpose and even the clinical laboratory. They use the biorate methods. So what are the KZ methods? So in this method, you can see mainly depends on the nitrogen estimation. Okay, so nitrogen which is present in the protein that is estimated. So here you have to estimate the nitrogen which is present in the protein. So in the proteins, you can see on average there is a 60% of nitrogen is present. So you can say the weight of nitrogen into 100 by 16, or directly you can say nitrogen into 6.25, and that will give the value of proteins in that given sample. So this is the principle of KZ methods. Okay, so based on the content or amount of nitrogen present in the proteins, based on that. Okay, so what is the advantage of this method is it is a reference method, most accurate and precise. So note down, reference methods, most accurate and precise methods, but still it is not used in the clinical laboratory now because it is time consuming, unsuitable for the routine clinical work. That's why it is not used. Time consuming. Nowadays you need to see reports very fast. That's why if it time consuming, if it a lot of time, you cannot use in the clinical practice. In the clinical laboratory you cannot use because the reporting time will be delayed. That's why it is not used nowadays, even though it is a difference more accurate in the precise methods. The Lowry methods, this is based on the reductions. So there is a reduction of phosphomolybdic acids and the phosphotangustic acids by the tyrosine residue of the proteins. So this tyrosine which is present in the proteins that causes the reduction of the phosphomolybdic and the phosphotangustic acids. So this is basically based on the reduction properties. That is the principle of the Lowry methods. So the advantage, you can say, very sensitive. Protein content even in the microgram can be measured. Generally we are measuring in the gram per dl. In the gram we are measuring the protein in the bloods, but by this method, by Lowry methods, you can measure in the microgram per dl. Okay. Disadvantage, if tyrosine and the tryptophan content of the protein is to be tested, a standard should be the different. Okay, different standard, then accuracy will be lost because you will be using the different, like for the tyrosine and for the tryptophan, different standard, then accuracy will be lost. That is a disadvantage of the Lowry methods. But advantage is very sensitive, and even you can measure in the microgram range can be measured by the Lowry methods. Most common methods what you have used, that is biorate methods. So this is basically based on the peptide bond. The peptide bond which is present in the proteins, that is measured here. The reaction between the reagents and the peptide bond present in proteins. That is the main basis for the biorate methods. So what you can say, peptide bond present in the protein react to the copper sulfates in the alkaline mediums and gives the color that is a purple to violet color, and color is compared with the standard that will be using, okay, and which is measured at the 540 nanometer. So basically the amount of peptide bond present in the proteins, based on that the intensity of color will develop. More the peptide bond, more intense color you will get. So in intensity of color is directly proportional to the concentration of protein in given samples. So based on the peptide bond, as you know, between the two amino acids there is one peptide bond. So it will keep on linking the adding the amino acids, and there is a many number of peptide bond will be present in that proteins. So based on the peptide bond, the color will differ, intensity of color will be differ, which is measured at 540, and the color you can notice purple to violet color. and you have to alkaline medium. The reaction takes place in the alkaline medium. So you have to remember here is peptide bond, alkaline conditions, and the intensity depends on the number of peptide bond and measure at 540 nanometer. Then you can take the reading against the blank or against the distilled water. So this is a procedure what you have given in your manual. So biotic reagents you have to take in all these three test tubes, blank, standard and the test. As you know, it will be labeled as the B, S and the T, blank, standard and test, 5 ml, and then protein standard which concentration is 6 gram per day. Concentration is 6 gram per day, 0.1 ml. Okay, and the serum also 0.1, distilled water 0.1, and mix it properly, and you can incubate at the room temperature for 10 minutes or at 37 degrees centigrade for 5 minutes, and take the reading at 540 nanometer against the blank. So this blank you can make the instrument 0 colorimeter 0 with the blank and take the reading of a standard and test. This is the one way you can do. Second one, make the colorimeter 0 with distilled water and take the reading of optical density of blank, standard and test, all these three. And during the calculation what you can do, you can minus the optical density of blank from the standard and the test. Okay, OD of test minus OD of blank, OD of standard minus OD of blank you can do, and then you can do the calculations into concentration of standard, that is a 6 gram per day. So normal lengths, already I think you have not forgotten the normal lengths of proteins. So it is a total protein 6 to 8 gram per day. 6 to 8 gram per day, that is a total proteins. And the commonly main protein in the blood, that is albumin and the globulins. So albumin is 3.5 to 5.5 gram per day. Similarly, globulin is 2.5 to 3.5 gram per day. And you can take the ratio between the albumin and globulin, that is known as the AG ratio, A by G ratio, that means albumin by globulin ratio, and that is 1.5 is to 1 is to 1 to 2.5 is to 1. So on our average you can show 2 is to 1, that is a AG ratio. So this is a normal length of proteins which is commonly measured. So this globulin you are not going to measure, you can calculate this globulin from total proteins minus albumin. So you will get the value of globulins, total proteins minus albumin, and it gives the globulins, that is 2.5 to 3.5 gram per day. So this is a normal length of serum total proteins, albumin, globulin and the AG ratio. So the clinical conditions. So what are the cause for increase in total proteins or decrease in the total proteins? And that is known as hyperproteinemia and hypoproteinemia. So what are the different causes? What are the different diseases where you can find increase in the total proteins or decrease in the total proteins? So we'll discuss one by one. So in the hyperproteinemia, dehydrations. There is a dehydrations, the level of protein will increase. If you measure the serum proteins, it will show the hyperproteinemia. Similarly, hemoconcentrations, multiple myeloma. So in the multiple myeloma, it is a cancer of plasma cells. So globulin chain will be increased. The concentration of globulin will be increased. So if you take the total protein, it will be increased. Even though there will be decrease in the albumin, but total protein will be increased due to the increase in the globulin fraction. Rheumatoid arthritis, tuberculosis and the Kala-Azar. So these are the few conditions where you can see increase in the proteins. Okay, these are chronic disease, tuberculosis and the Kala-Azar, where the protein is increased. Even the rheumatoid arthritis, there is an increase in the proteins. So there are a few conditions where the total protein is increased: dehydrations, concentration, multiple myeloma, rheumatoid arthritis, tuberculosis, and the Kala-Azar. Hyperproteinemia, where the level of protein is decreased, proteinuria, low protein intake, malabsorption, nephrosis, hemorrhage, shock, untreated diabetes mellitus, hyperthyroidism, and the severe liver diseases, where you can see the decrease in the total proteins. If there is a liver disease, the protein synthesis will be decreased, so you can have a decrease in the total proteins. If with the low intake, if the urine is lost, the protein is lost in the urine, that time also the blood level will decrease. Malabsorptions lead to decrease in the protein level. So these are the few conditions where you can find decrease in the serum protein. So in the exam, what are the probable questions can be asked from the total protein is, like they will ask what is the proteins, as you have discussed in this starting. What is a protein? Can you classify the proteins? Function of proteins, and how the peptide bond is formed. What is the characteristic of peptide bond? And the practicals they might ask for the different conditions where the protein is increased or decreased. What is the importance of blank? Importance of a standard? What is the different type of blank can be used? Okay. And what are the sources of proteins? That might ask in the viva questions during the practical viva, not in the theory, in the practical viva. And what is the different normal lengths for the different proteins, like total proteins, albumin, and the globulins? What is the normal length? And AG ratio, what is the normal length? So that might be asked. And even the dipeptide, tripeptide, what is the example of tripeptide? So these are the few questions. How peptide bond is formed, like between the two amino acids, how it is formed, like how there is a N and the C terminals, how it is generated. So that is related with the formation of the peptide bond. And what the principle of biorate methods? What is the advantage and disadvantage of different other methods? Why other methods are replaced? They might ask. There is a Lowry methods, Zeldal methods. Why that is replaced? What is the reason behind that? So that might be asked during your critical viva. So you'll be able to answer. You can have to say the disadvantage of that method. Advantage or disadvantage. If you say the disadvantage, due to that all the methods are replaced. Okay. So now we'll discuss estimation of serum albumin. So this is a major plasma proteins, albumin and the globulins, which is a major plasma proteins, and this can be estimated different methods. If you are not forgotten, BCG, BCP, these are the methods by which we can estimate the serum albumin. BCG and BCP. Reynolds biurate methods. This is the one scientist who have modified the biurate methods for the estimation of serum albumin. But you have used this BCG methods. You have used the BCG method, bromocresol green dye binding methods. You have used this. If you ask the alternative methods for the estimation of serum albumin, you have to say bromocresol purple. This is also the dye binding methods. This is also the dye. Here it is a green and this is purple. That's all. That is only difference. Okay. Bromocresol green and bromocresol purple dye binding methods. Reynolds biurate method. It's a modified biurate methods. By this you can estimate the serum albumin. These are the three methods, but commonly used the BCG. If you don't have the BCG reagent, you can use the BCP, bromocresol purple dye binding method you can use. So there are different methods for the estimation of serum albumin. So what is the principle of this dye binding method, BCG? So here the condition is the acidic. In acidic conditions, albumin present in serum bind to the bromocresol green to form complex, that is the albumin BCG complex, which is measured using the colorimeter at 520 nanometers. And intensity of color is directly proportional to the concentration of albumin present in given sample. Okay, so here there is a formation of the complex. As you know, the by name, it's a dye binding method. So albumin will go and bind to the dye, and due to that there is a formation of the color, and which is measured at 620 nanometer. 620. Till now, in the different methods like the cholesterol, sugar, and the total proteins, we are using generally the 520 or 540 nanometer. But in the case of albumin, it is 620 nanometer. That is the difference you have to remember. If you use the 540, you will not get the accurate results. So you have to use the 620 nanometer. And intensity of color is directly proportional to the concentration of albumin in the given sample. Here it is a acidic conditions. In the biorate it is the alkaline conditions, but in the BCG dye binding method it's a acidic conditions. This is the procedure of BCG methods. So BCG reagents you have to take in all these three test tubes as you perform earlier: blank, standard, and test. 2.5 ml. The standard, which concentration is 3 gram per dl. Protein is standard, concentration is 3 gram per dl, 0.1 ml. Sample, that is the serum, it is a 0.1 ml. Distilled water, 0.1 ml in the blank, and you can incubate it 37 degrees centigrade for 5 minutes or room temperature for 10 minutes and measure at 620 nanometer. Okay, measure at 620 nanometers or 630 nanometers, 640 nanometers, whatever is available you can use it. Okay, after that you can take the reading against the blank or against the distilled water, as I have explained to you earlier. For the distilled water, make the colorimeter 0 with distilled water and take the reading of blank, standard, and test, and at the end you can minus the optical density of blank from the standard and the test, and you can calculate OD of standard, OD of test by OD of standard into concentration of standard, that is 3 gram per dl. OD of test by OD of standard after removing the concentration of blank. Or if you will take the directly against the blank, no need to subtract the blank. Directly you can write down the OD of test by OD of standard into concentration of standard, that is 3 gram per dl. And while you are writing in your exam for the blank, standard, and test optical density, here you don't write anything. In the blank, don't write anything. Generally you will be writing the 0, 0. No, don't write 0, 0. No need. If you are taking the optical density against the blank, no need to write. If you are taking against the distilled water, then only you can write the optical density here. Against the distilled water, then you can write here optical density. If you are taking against the blank, don't write. No need to write. Just leave it blank here, and you can write the OD of standard and OD of test. That's all. Don't write here 0, 0. Does not mean anything. That will create the confusion. They might ask the question, why you are writing here 0, 0? You might say that you have set the colorimeter 0 with the blank. Then you will ask why. Then why you are writing here? So rather to face that questions, no need to write here. Just you can write in the standard and the blank. Normal length. Again, the revision for you: 68 gram per dl for the total protein, 3.5 to 5.5 gram per dl for the albumin, globulin 2.5 to 3.5, and Ag ratio on average you can say 2:1. Clinical significance: in which condition there is increase in albumin or decrease in albumin, hyperalbuminemia or hypoalbuminemia. What the different conditions where you can see decrease in serum albumin or increase in serum albumin. So increase, there is a very few conditions. Mainly it is related with the decreased conditions, clinical significance, like dehydrations, that might be due to the diarrhea or vomiting. In that conditions, you will see increase in this serum albumin, dehydrations, due to the dehydration or vomiting or any other cause. If there is a dehydrations, that leads to, or in that conditions, you will see increase in the serum albumin. But mainly, as I said, it is related with the decreased conditions. So loss of albumin, you can make the heading, defective anabolisms, and one more, increase the catabolism of proteins. So you can divide the three headings. So the loss of albumin, you can see in the case of nephrotic syndrome, protein losing enteropathy, virus fat bonds, severe hemorrhage. So in all these conditions, there is loss of albumin, severe hemorrhage in the bone case, nephrotic syndrome, protein losing enteropathy. So in all these conditions, there is the loss of albumin. Defective anabolisms, that means the albumin is not synthesized properly, like in the liver disease, there is a decreased or impaired synthesis of the albumin, you can say. Malnutrition, defective digestion, or malabsorption, as you can see in the case of the carcinoma of the stomach or pancreas, in the peptic ulcer, enteritis, steatoria. So all in these conditions, like there will be the defective digestion and absorption, you can say. Defective digestion and the malabsorptions due to any reasons. Okay, so we'll have the decreased level of albumin. One more, like in the fever after injury, decrease in the albumin, severe hemorrhage, acute infections like diabetes mellitus. So all in these conditions, there will be decrease in the albumin. So in the pregnancy, there is a decrease in albumin. So why there is increase? As you know, there is a increase the demand. Due to that, we'll have the decreased level. So you can see the 10 gram per liter. 10 gram per liter. So if you take the mg, it will be 1. Last time I said due to the partial increase the requirement, and due to that partially to increase the plasma volume. So in the pregnancy also there is a decrease in the albumin level. Some other conditions like very rare congenital system and albuminemia and albuminemia, and means absence. Okay, there is absence of albumin. So plasma albumin is almost completely absent. A small amount can be detected by the sensitive immunological techniques. Immunological techniques, like you can see the ELISA here, that methods you can perform. Okay. Otherwise, there will be a complete absence of the albumin, plasma albumin. Albuminemia, you can say, in which albumin appear as the two roughly similar peak. It's about the half as intense as the normal band. The structural analysis has shown that one band is normal albumin and another is a genetic variance. So if there is a two peak, one is due to the normal albumin, another is due to the genetic variant. So due to this, okay, it is known as the albuminemia. So this is another term which is related with the albumin, edema. So probable when the albumin concentration falls below the 20 gram per liter. 20 gram per liter. If albumin is less than 20 gram per liter, it's lead to the development of edema. So what happened here? Water is forced in the tissue space. Okay, water is forced in tissue space, resulting in the edema. Lower plasma proteins level causes the decrease in the plasma osmotic pressures. Okay, osmotic pressure is also decreased. Due to that, water is forced in the tissue and lead to the edema. Okay, so due to that, this is a very good prominent feature you can see in the patient who have a decrease in the albumin level. And this fluid retention is aggravated by the increased secretion of aldosterone. So this will also aggravate. Reduction in the total protein is one of the cause for the edema. So you can say the depends on the colloidal osmotic pressures or oncotic pressures, which is maintained by the albumin. If there is a decrease in the albumin, this pressure will not maintain and finally leads to the edema. That is the main reason you can say, not maintained in the oncotic pressures, which is balanced by the or maintained by the albumin. If there is a decrease in the albumin, this pressure is not maintained, oncotic pressure is not maintained, and finally there will be the edema. Okay, fluid will be present in the different tissue. So this is all about the albumin. So here different questions might be asked is what is albumin, what is the different function of albumin, okay, how it there is a decrease in the albumin, how there is development of edema, and how albumin can act as a transport proteins, why it is known as the transport proteins. So what are the different compound which is transported by albumin? So they might ask this one, and same type of question they might ask regarding the blank, standard, and the test. So what the importance of all these three, and what is the concentration of the standard they might ask, which is given to you. It is a 3 gram per day. Sometimes they might ask how to prepare the standard also. Sometimes it depends on the external. So how you can prepare this standard with 3 gram per day. So how much albumin you have to take? Albumin powder. So what is the amount of albumin powder and the water which will be used? So how you can prepare this 3 gram per deciliter. So this type of question they might ask. Similarly, they might ask about the clinical significance. Increased condition, decreased conditions. They might ask you. So why on all these conditions there will be increase or decrease in the serum albumin. And mainly they will be discussing on the function of albumin they might be asked mostly, and the related diseases. So this is all about the total protein and the albumin, which can be asked. So you have to hear like causes of edema, normal range, clinical significance, function of albumin, blank, standard, and test. What is the importance of that? And sometimes some of the external they might ask like what are the things you are having, like what are the sources of this albumin, which food contains this albumin, that might be asked. Even like what you are having, like different dry foods, so at the different concentration of the proteins they might ask you, like even the chips, what is the content of albumin or proteins is present, they might ask. So when you are using those fast food, you can see what is the concentration of that. Depending on company it might be different, so on the average you can see. So these are the few questions they might ask you. So this is all regarding the albumin and total proteins. So in the next class we'll be discussing what will be the topic. First I will disconnect this. Thank you for